response teams o mga healthcare providers para po sa tamang atensyong medikal. Piliin niyo pong magpabakuna at hikayatin niyo po ang lahat ng inyong mahal sa buhay na eligible na, ngunit hindi pa rin nababakunahan na magpabakuna na po. Tayo po ay mayroon ng sapat na supply ng bakuna para makapagpabakuna na po ang lahat ng eligible population natin. Bagamat nakakakita na tayo ng pagbaba ng kaso nitong mga nakaraang linggo, nakasalalay pa rin po sa ating lahat ang pagsunod sa minimum public health standards at agarang pagpapatupad ng mga kinauukulang PDITR plus V strategies ang magiging lagay ng ating COVID. So tayo po lahat ang inaasahan para po natin mapa-sustain ito pong patuloy na pagbaba ng kaso dito sa ating bansa. Ayaw na po nating bumalik sa dati nating kalagayan na lagi po tayo nagla-lockdown, kaya patuloy po tayong lahat na mag-ingat and let us do our part in preventing COVID-19 infections and stopping its transmission in our homes, in our workplaces, and in our communities. Jolo.
Maraming salamat po, Yusek, for giving us those reminders. And now for our media questions, we go straight to the question of Caroline Bongkin of CNN Philippines. For a question po, Presidential Advisor Joey Concepcion says they will be pushing for no more quarantine protocols for fully vaccinated travelers from abroad. Instead, there will be a PCR test 48 hours before departure and another test upon arrival. Is this kind of protocol safe? What does science say about this? Gaano kalaki ang positivity rate sa fully vaccinated travelers from abroad?
Well, Caroline, unang-una gusto nating sabihin na ito'y pinag-uusapan na actually this was part of the discussion in the IATF yesterday. At ito po ay further na pinapaaral sa atin ng IATF officials para makita po natin talaga ang mga pros and cons based on scientific evidence. So alam po natin, anything can happen in between when you go and travel from your point of origin to your country of destination. So kailangan talaga mabusisi po nating pag-aralan ito para hindi po natin magkakaroon tayo ng increased risk of infections kung sakasakali. So pinag-aaralan, and maybe in the coming weeks after the IATF next week, we can already provide appropriate recommendations based on science and evidence.
Thank you po, Yusek. The next question is from Sheila Crisostomo of the Philippine Star. May nag-apply na ba ng pharma companies for EUA para sa vaccines na gagamitin as booster and third doses? Scenario lang, what if walang nag-apply?
Sheila, meron nang nag-apply sa atin nitong mga 4 boosters and third doses. We have Pfizer, we have AstraZeneca, we have Sinovac, and we have Sputnik V. They have all applied for these boosters and third doses. Ngayon po, kinukumpleto na lang ng Food and Drug Administration together with our vaccine expert panel ang kanilang mga ebidensya para po dun sa evaluation. We are just wanting to wait for the completed SAGE recommendations, which is the last piece of evidence that we will need para po tayo ay makapagbigay ng appropriate recommendations. But nevertheless, yung SAGE recommendations po ay lalabas, ngunit the EUA, kung kumpleto na po ang evaluation, ay maaari na rin pong i-issue.
Thank you po, Yusek. Another question from Sheila Crisostomo. Kailan po magsisimula ang vaccination para sa 5 to 11 years old?
Yeah, Sheila, lagi naman kapag tayo ay nagbabago ng age group o may dinadagdag na age group dun sa mga pwedeng bakunahan with a specific brand of vaccine, kailangan po nating antayin yung Emergency Use Authority. Hanggang sa ngayon po, wala pa hong manufacturer that has already applied for an EUA for the 5 to 11 years old. Ang sabi po ng Food and Drug Administration, they are expecting submission already from Pfizer kasi dun sa US FDA na aprubahan na siya, and usually daw apparently according to FDA, kapag nakakakuha na ng Emergency Use Authority sa US, ang manufacturers ay agad-agad na nagsusumite sa iba't ibang bansa ng kanilang application for this specific age group. So aantayin natin na mag-apply sila, and then we will wait for the evaluation and the issuance of EUA from the Food and Drug Administration.
Thank you po, Yusek. Another question from Sheila Crisostomo. May we get the data on COVID-19 infections since NCR was placed on alert level 2?
Yes, Sheila. So we have different metrics that we use so that we can be able to determine what alert level an area is. For example, ang NCR po, siya po ay may mababa na siyang ADAR. So it's just 3.27. per 100,000 population. They have a negative 2-week growth rate, and also their healthcare utilization is just about 27%. For ICU, they have about 37%. So mababa na po yung metrics ng NCR. That's why they were de-escalated to alert level 2. Ang average 7-day moving average of daily cases ng National Capital Region ngayon ay 422. This is lower by 14%. So ito po yung 7-day moving average ng November 5 to November 11 compared to October 29 to November 4, which was at 490. So bumaba na po at patuloy na bumababa. Sana tuloy-tuloy pa rin po ang pagbaba ng mga datos na ito.
Thank you po, Yusek. The next question is from Aiko Miguel of UNTV. WHO said there will be a shortage of 1 to 2 billion COVID syringes next year, and this could slow down COVID-19 vaccination and even other routine immunizations. Have we secured a supply of syringes for COVID-19 vaccination? Do we still have enough supply of syringes for the inoculation of more Filipinos by 2022? Similar question with Lay Alvis po.
Yes, Aiko and Lay, no? So we have anticipated this kind of shortage as early as May to June of this year. Kaya po, nung June, inutusan na po natin ang ating mga regional units na maari muna nilang gamitin yung mga tuberculin syringe instead of this kulang na mga 0.3 ml syringe. For the other types of vaccine, wala po tayong problema kasi marami po tayong commodities that are in our storage facilities na maaring gamitin para po dun sa mga ibang klaseng requirements for other vaccines. Pero ito pong 0.3 ml syringes na specifically ginagamit po for mRNA vaccines, ito po ang nagkukulang and shortage din globally talaga. So as early part of this year, we already have placed our orders and our procurement process through the Unicef. But hanggang sa ngayon, medyo nagkakaroon ng delays ang kanilang delivery sa atin. And this is because of the apparent global shortage na sinasabi. So sa ngayon, ang ginagamit po ng ating mga implementing units are tuberculin syringes that were procured through their money dun po sa ating mga regional offices. We are now trying to explore other means so that we can source out this kind of syringes para hindi po tayo nagkakaroon ng ganitong kakulangan.
Thank you po, Yusek. The next question is from Sofia Tomacruz of Rappler. How big of a factor is the WHO SAGE's recommendation in the government decision to roll out booster doses and third doses? Will additional shots be given according to the HTAC's recommendation in the event that the SAGE advises countries that boosters or even third doses are not yet needed po?
Itong SAGE recommendations, kasama yan sa inputs na gagamitin ng ating mga experts kung sakasakali. If you remember, there was this October 5 interim recommendations that was already released by the WHO. At ang ating ngang usapan nun, ang ating binigay na palugit, no? Sabi natin, antayin natin yung completed SAGE recommendations plus the EUA of the Food and Drug Administration. With the current evidence that we have, ito po ang pinag-aralan ng maigi ng ating vaccine expert panel at saka ng Food and Drug Administration para po kung sakasakali makapag-issue tayo ng emergency use authority. The SAGE recommendations will just be an additional evidence for our vaccine experts and the Food and Drug Administration. So kung sakaling lumabas po itong SAGE recommendations, of course, it will be part of the considerations. But as I've said, the EUA is already being evaluated by our vaccine expert panel and the Food and Drug Administration. And base po sa aming updates coming from them, mukhang kumpleto naman yung naging ebidensya na ginamit, dahil nakapagsumiti rin ang mga iba't ibang manufacturers ng kanilang mga trials, base dun sa documentary requirements na hiningi. So ito pong SAGE recommendations, kapag dumating ito po ay isasama as part of the considerations for us to be able to implement boosters and third doses. But the EUA, base sa mga ebidensyang meron ngayon, maaring lumabas yan mauuna at maari din pong maipatupad at ang SAGE recommendations will be a consideration later on kung ito ay lumabas na.
Thank you po, Yusek. The next question is from Red Mendoza of the Manila Times. Sinabi po ni Dr. Maricar Limpe na dapat daw pag-isipan muna ang pagluwag sa Alert Level 1. Ano po ang inyong reaksyon dito? Sa Yusek, baka we can explain our metrics po to de-escalate to Alert Level 1.
Red, hindi po kami agad-agad na nagluluwag. Pinag-iisipan din pong maigi ng ating gobyerno ang pagbababa ng mga or pag-de-escalate ng ating mga areas sa different alert levels, especially the lower alert levels. As we have always said, our alert level system metrics, no, when we determine that, is non-appealable, it's non-debatable. So pag nilabas po natin yan, hindi po yan pwedeng i-apila, hindi po pwede nating baguhin. What we can change and what we can discuss on would be the interventions for each of these alert level system. So ang alert level system po natin comprises of metrics na alam nyo na po yung 2-week growth rate and average daily attack rate for our case classification and our healthcare system capacity, which is represented by our hospital beds. No? So pag tinignan ho natin yan, once you get to alert level 2, you are already at low risk. Ngayon, para ang isang area maging alert level 1, meron po tayong karagdagan na requirements. Dapat po, para maging alert level 1, meron kang 70% vaccination coverage for your senior citizens, meron kang 70% vaccination coverage for your individuals with comorbidities, at saka meron ka dapat 70% of your 70% target from your eligible population. So these three things should be there for you to be able to be de-escalated to alert level 1. Another factor or requirement is that at the very least, meron po kayo dapat safety seal sa mga establishment. Pinag-uusapan po ngayon ng IATF kung ano yung baseline or threshold na ilalagay natin para po yung safety seal ay kasama rin sa requirements para ikaw makapag-de-escalate. So it is not just the metrics na low risk case classification and low risk ang iyong healthcare utilization. Kailangan yung vaccination coverage rin mo ay ma-achieve mo yung mga sinabi ko na 70% sa A2 and A3 and 70% of the 70% of your target population, ibig sabihin yung ibang eligible population, and the safety seal certification. So it is not na agad-agad magbababa tayo sa alert level 1. Meron po tayong safeguards, and the vaccination coverage and the safety seal requirements are safeguards for the population para kung sakaling ibaba natin ang area sa alert level 1, tayo ay may safeguard or meron tayong kasiguruhan na tayo po ay magiging protektado kahit na mag-ease na ang restrictions.
Thank you po, Yusek. Another question from Red Mendoza. Ano po ang posisyon ng DOH sa self-administered home antigen tests? Will the DOH consider this in the coming years and will count towards our case numbers?
Well, ngayon po ang pinag-uusapan na with our experts, what would be the direction of our testing methodologies in the coming months and in the coming years. Kailangan natin isipin pa rin, because a lot of people are saying that medyo magkakaroon ng pagbaba ng requirement for testing dahil bakunado na ang mga tao. Yun pong konsepto na yun ay hindi ho namin maikonsidera dahil alam po namin na kapag tayo ay bakunado, maaari pa rin tayo magkasakit at maaari pa rin po tayo makapanghawa. So kailangan nandun pa rin po talaga yung testing strategy natin. Pero yung moving forward and looking at other methodologies, ginagawa na po natin yan ngayon, pinag-aaralan. We have our consensus panel of experts from the Living CPG Group, the Living Clinical Practice Guidelines Group, at meron po kaming pagpupulong or meeting sa Lunes para pag-usapan po ito para po sa initial directions natin. So this self-testing antigen test kit will be included as part of this evaluation and discussions, and we will be informing all of you.
Thank you po, Yusek. I will now be moving on to the Zoom chat questions sent by our media. So for the first question from Rafael Bosano, update po sa booster or third dose, kailan daw po lalabas ang EUA? Kaya pa po bang magsimula ang pagturok nito sa initial target na November 15?
Well, Rafi, I cannot be certain as to the specific date on when this will be started because katulad ng lagi naming sinasabi, pag lumabas ang EUA, maglalabas pa ng guidelines ang Department of Health. Although kami naman, habang inaantay natin itong EUA, we have already started preparing for these guidelines para as soon as lumabas yung EUA, maipapalabas natin ang operational guidelines natin. Pero kasi kapag lumabas ang EUA and with our operational guidelines, kailangan ng implementing units handa rin sila. Kasi magkakaroon na tayo ng 2 tiers of vaccination. Yung isa, yung primary series, Ito yung tinuturok sa atin na panguna, no? Yung unang 2 doses natin. Yung isang tier natin, itong mga boosters or third doses for specific priority groups katulad ng immunocompromised, senior citizens, and healthcare workers. At iyan po kailangan mapagplanuhan ng maayos at kailangan din po na mapag-usapan at mabigyan ng instruction ng ating implementing units. Of course, when the EUA comes out, atin pong ipa-facilitate agad para maumpisahan natin itong mga ating binabalak.
Thank you po, Yusek. The next question is from Lee Alvis po. Follow-up question lang po regarding tuberculin syringes. Ano daw po ito?
Well, the tuberculin syringe, unang-una, ito ay maliit na syringe, no, Lay? It only contains about 1 ml na gamot, no? So pag nakita mo yung mga syringes kung gaano siya kalalaki, meron kang 1 ml, may 3 ml ka, may 5 ml. Ang tuberculin syringe kasi kaya siya tinawag na ganyan, usually ginagamit yan para dun sa ating tuberculin na parang test, no, that you do for TB. Kaya siya tinawag na ganyan. It's usually used para sa mga subdermal, no, sa ilalim lang ng balat. Pero ito, appropriate siya na gamitin para dito sa mRNA vaccines kasi maliit na dose ang kailangan for mRNA vaccines, 0.3 ml. So ito, nagagawa natin that it can also be used for that in place of this auto or these AD syringes for Pfizer, no? Kaya po nagawa natin ng paraan mula nung Hunyo na yung mga nagkukulang sa mga ganitong klaseng hiringgilya, yun muna ang ginamit nila.
Thank you po, Yusek. Another question from Red Mendoza po of the Manila Times. Di po ba nag-aalala ang DOH na baka too late na if we would wait for the recommendations before we can give booster doses po?
Red, I think you're coming from that statement na may mga nagsasabi na mga grupo na kapag walang booster ay magkakaroon tayo ng pagtaas ng mga kaso natin. Unang-una, gusto po nating tawagin ang pansin ng mga grupo na ito na nagbibigay ng ganitong statements kasi po ito ay nakakapag-cause ng confusion sa ating public. Kailangan lang po nating intindihin na ang base sa ebidensya at base sa mga pag-aaral na ginagawa ng mga eksperto and even based from the experiences now happening in other countries where there are again increases in their cases, the unvaccinated ang nakakapag-cause po ng pagtaas ng kaso sa isang bansa. Hindi po yung kakulangan ng boosters. So may we call on to all of those groups stating this kind of statements to be very careful and cautious because the public is getting confused. We should all be basing our statements on science and we should all be prepared to have this kind of evidences with us whenever we make this kind of statements. Let us all be responsible in issuing our statements.
Thank you po, Yusek, for the clarification. May follow-up question lang po si Aiko Miguel from UNTB. How many 0.3 ml syringes did we order po sa Unicef?
We have ordered 44 million 0.3 ml syringes from the Unicef at the outset, no? Pero ngayon, katulad nga ng sabi ko, Aiko, when the WHO already informed us unofficially, actually unofficial yung information na dumating sa amin, minobilize na namin yung aming pharmaceutical division, Food and Drug Administration, and our Disease Prevention and Control Bureau para map out ng ating mga resources and also to be able to explore dun sa mga suppliers para tayo magkaroon ng prepared na stocks for these 0.3 ml syringes.
Thank you po, Yusek. Follow-up question po from Caroline Bongkin. Ilan daw po ang ADAR and HCAR needed to de-escalate po to alert level 1?
Yes, Caroline, yung ating low-risk case classification has to be sustained for 2 incubation periods. So halimbawa, ang isang lugar ay nakapag 2 weeks na, kailangan mo pa ng another 2 weeks na sustained na low case transmission ka. Pero katulad nga ng sabi ko, aside from these case metrics, kailangan yun pong vaccination coverage at saka safety seal, mako-comply mo rin because this is an additional safeguard for our population.
Thank you. Thank you po, Yusek. Next question is from Bons Magsambol of Rappler. May decision na po ba sa face shield? Nakapag-present na po ba ang DOH sa IATF?
Yes, we were able to present yesterday ang ating mga rekomendasyon sa ating IATF. Meron na rin po silang desisyon, but it will be the Office of the President to decide first, and then it will be announced by the Office of the President.
Thank you po, Yusek, for the clarification. The next question is from Joanna Ley Casilao of GMA News Online. Pahabol na question po sana, what does having a positivity rate of 5% or lower mean for the Philippines? Will this lead to a change in policy po?
Unang-una, Joanna, ang 5% is the benchmark na sinabi ng WHO na 5% or less, yan yung ideal. Kumbaga, pag less than 5% ang positivity rate mo, ibig sabihin, mababa ang case transmission mo. So ito pong 5% or less, hindi po nababago ang protocols. Ang protocols po natin applies for any type of positivity rate, or whether it be high or whether it be low, yung protocols are the same. But what we change would be the intensification. And of course, pag patuloy pong bumaba ang positivity rate natin, nagpaplano na po tayo ng succeeding na mga eventual na pagbubukas ng ibang industriya, and also looking at how we can be able to sustain the behavior of our citizens, so for all of us to shift into this new normal. So the protocols will always be the same, hindi po nababago.
Thank you po, Yusek. Another question. The next question is from Jen Calimon po. Based on Octa Research's Gonang Masa survey, there is a 30% decline in Filipinos' approval of the government's COVID-19 response. Only 17% said they truly approve of government's response, while 33% somewhat approve. May we get DOH's reaction po on this?
Yung pong mga ganyang survey, that helps us improve on our response. No? Wala naman pong perfecto na response, even in other countries. Meron pong mga angking weaknesses ang ating sistema dito sa ating bansa. Meron pong mga angking kakulangan sa resources ang ating bansa. But we try to make the best out of what we have right now. And ito po mga survey helps us to improve, and we just continue our work.
Thank you po, Yusek. And then another question po from Jacob Lazaro. Follow-up question po, does this mean the DOH is not seeing a spike in cases in the near future due to waning immunity of vaccines daw po?
Unang-una, Jason, yung waning immunity, yung ebidensya niyan ay patuloy pa rin nating kinukumpleto. Meron na pong mga initial evidences that are saying na 6 months after the immunity wanes. Meron naman iba 9 months. Meron namang iba 12 months sa iba't ibang bakuna. So lahat po yan kinukumpleto natin at kinukonsidera. Kaya nga po by next year naka-propose na at sana po maaprubahan, of course, ito pong budget natin for boosters for next year. Dahil alam po natin na kailangan for this year, kumpletohin muna po natin yung mga hindi pa bakunado. Pero katulad din ng rekomendasyon ng SAGE or ng WHO, merong mga piling sektor sa ating bansa na kailangan bigyan ng third doses dahil hindi po nag-mount ng effective immunity ang kanilang katawan because of their condition, inherent conditions, immunocompromised individuals. And of course, yung vulnerability ng ibang sektor sa ating bansa, katulad po ng ating healthcare workers. Kaya yan po yung ating mga pino-consider para po dito sa mga iba't ibang ginagawa natin na strategies. But not to say, kailangan mabigay natin ng tamang information sa ating mga kababayan. Na hanggang sa ngayon po, sinasabi naman ng mga eksperto natin at sinasabi rin ng ebidensya, kung anumang bakuna ang meron tayo, it is still effective against severe diseases and deaths. Kailangan lang po talaga pag-aralan maigi bago po tayo makagawa ng panibagong hakbang. Dahil may iba pa po tayong kinukonsidera sa buong populasyon, katulad ng equity component natin, where a lot of individuals still needs to be vaccinated. So kailangan very strategic po tayo kapag tayo ay nagpatupad ng panibagong vaccination strategy.
Thank you po, Yusek. The next question is from Red Mendoza of the Manila Times. What does the DOH think po of the mandatory vaccination of workers starting December 1?
Katulad ng lagi naming sinasabi, no, it will depend if we have a law to support that. So ayun naman po ay nakapagbigay na ng posisyon ng ating Department of Justice na kailangan ng batas para tayo ay magkaroon ng ganitong mga klaseng mga mandates. Pero yun pong imamandato at sasabihin na kailangan bakunado ang mga workers natin, yun po naman katulad ng sabi ko, may specific sectors po tayong iniisip in the part of the Department of Health para maging mandatory. And unang-una na po dyan yung healthcare workers na kailangan po maging obligasyon natin at responsibilidad na magpabakuna tayo para maproteksyonan natin ang ating sarili and of course to protect also your patients. So may specific sectors na susuportahan ng Department of Health, pero yung suporta namin kailangan may basihan din po kami ng batas. Kaya antayin po natin ang Department of Justice to give their statement on this.
Thank you po, Yusek. For the last question from Aiko Miguel, ano po yung liability ng mga nagturok ng booster shots or third doses na po?
Sa ngayon, Aiko, we had been hearing a lot of reports, kaliwat kanan, nagpapa-booster doses ang ating mga kababayan. Unang-una, kailangan maintindihan nyo, wala pong emergency use authority ang ginagamit nyo ng mga bakuna. Pagka nagkaroon po ng, wag naman sana, aberya o kaya untoward reactions to these booster doses, government cannot be held accountable. The ones accountable will be the ones who gave you those vaccines and who have sourced out these vaccines. Pangalawa, you are violating national protocols kung saan ang boosters hindi pa ho kasama sa ating mga guidelines and protocols. So just to remind everybody to wait for this emergency use authority or the guidelines from national government. Hindi po ito para i-restrict kayo, hindi po para i-control ang paglabas nito mga bakuna para sa mga ganitong gawain, ngunit para masiguro po ng gobyerno na ito po ay magiging ligtas at magiging effective para po sa ating mga kababayan.
Salamat po, Yusek. That's all the questions we can accommodate for today. And for your final message po, Yusek, to our kababayan.
Yes, sa pagtatapos po ng ating media forum, nais po namin uli magpasalamat sa ating mga media partners. Alam po namin, katulong po namin kayo sa pagpapakalap ng tamang impormasyon. Sa patuloy na pagbaba ng mga kaso sa ating bansa, mariin po namin inuulit, hindi pa rin po tapos ang ating laban sa COVID-19 na andito pa rin po ang virus. Bagamat binubuksan na po natin ang iba't ibang industriya sa ating bansa dahil binabalanse po natin ang ekonomiya at kalusugan. Pero kailangan tayo po ay maging mas maingat sa ngayon. Tayo po ay tumupad sa minimum public health standards. Palagi pa rin po tayo mag-mask at face shield. Huwag na muna po tayong pupunta sa isang lugar kapag nakita natin na crowded ang lugar, enclosed or closed space, at nakikita natin na wala na pong physical distancing ang mga tao. Pag-ingatan po natin ang ating mga sarili, pati na rin po ang ating mga pamilya, para po mapag-ingatan po natin ang ating buong komunidad. Sama-sama po tayo sa ating po nakasalalay ang patuloy na pagbaba ng kaso sa ating bansa at hindi na po na rin tayo makabalik dun sa ating mga dating pagla-lockdown sa ating mga lugar. So sana po tulong-tulong po tayo lahat na sumunod sa mga dapat nating gawin for our safety and for the safety of our family and the safety of all Filipinos. Maraming salamat po and happy weekend to all of you. Thank you, Jolo.
Thank you po, Yusek. Thank you to our media partners. Happy weekend po. Stay safe.